What a joyful time of the year this is. You get to be with your family members and eat good food, hopefully. But some of you may have to work this holiday season. I know I had to work Thanksgiving. Or maybe you have to work more than one holiday this winter season. But what if I told you during that holiday that you're working, your patients have an increased risk of dying? But before we get into it, do not forget to like this video and subscribe to my channel. But that's it. Let's get into the meat of today's video on why there is an increased mortality rate during the holiday season. Now, I've worked in nursing just over 6 years now, so I have gone through many holidays, many winter holidays in nursing, and have worked a lot of them. And I always noticed that the risk of dying, or the amount of deaths that I'm seeing, is higher than normal. And I thought, is it just because I'm paying more attention to it, or is it actually higher? And turns out, it's actually higher. But it's not just any old day during the holiday season. It's 3 specific days in particular. They are Christmas Day, the day after Christmas, and New Year's Day. Now my mind is just going, thinking, why is this higher? Why is there an increased mortality rate? Is it because there's higher suicide rates during the holiday season? Well, it turns out that's false. There's actually higher suicide rates during the spring and fall seasons, not during the winter season. Then I thought to myself, it's cooler outside. And quite frankly, are people actually freezing to death? I grew up in Pennsylvania, and some homeless shelters would meet capacity during the winter time and would have to turn people away. And there's times we're getting a couple feet of snow. But it turns out that is false also. Okay, and lastly, I thought, thinking about nutrition, is it because people are overeating? They're having too much sodium, it's overloading their system, they're having multiple cardiac events. And while that's not exactly true, there is some validity to that. So what is it? What is causing this increased mortality in your patients on your watch while you are taking care of them in the hospital during Christmas, the day after Christmas, and New Year's Day? After doing some digging through many articles, here is what I found. Quoting from an article that I read through, it states, Phillips, a professor in the sociology department at UC San Diego, and his team looked at the number of people who died in emergency settings and those who were considered dead on arrival between 1979 and 2004. They found a spike on those 3 days, the 3 days that I have mentioned multiple times now. It then goes on to say, a more recent 2013 study in Britain found patients admitted to hospitals as emergencies on public holidays are significantly more likely to die than those admitted on other days of the week, including weekends. Now, there are many theories out there on why this is happening, but no one has been able to pinpoint it exactly, according to one of the articles that I've read. Now, I am going to go through these theories with you, and to me, they make total sense, especially this first theory that I'm going to share. This one hits home. Think back to when you were a brand new nurse and the scheduler is doing the holiday schedule, the winter schedule, and you're putting in your PTO. Well, remember when you got to put your PTO in compared to other nurses? Who got to put their PTO in first? The more seasoned nurses, the nurses who have seniority, who have been there longer. It is thought that because those more seasoned, more knowledgeable nurses are off during the holiday season, most likely, this increases a patient's risk of dying. That's a scary thought. And I would be the first to agree that a nurse is a nurse, but you cannot put aside the fact that many years in nursing will give you more knowledge than a brand new nurse. You have to work the bedside. There's things that you only see at the bedside that you don't learn in nursing school. Now, theory number 2 has always kind of bothered me working in the healthcare industry, and this is limited access to care. Think of all the departments that shut down during the holiday season. The hospital is slower, you're not as busy normally at work on those days, patients aren't going to as many tests, the parking lot is a little less empty, but the cars in that parking lot are normally people and providers who are at the hospital caring for the patients, but they don't have to work on the holiday. And this is the theory that there's a limited access to care and not as many tests are being done, so it pushes things back, which increases the mortality rate in patients. The third theory that I'm going to share with you, I know is true, because I have had patients tell me this in the past. And that is that they are pushing off going to the hospital because they want to be with their family and they don't want to have to leave an event. And this ultimately could end detrimentally. Now, I'm sure there are many more theories out there, and I'm sure there are many more articles out there just based off of this. I did link all the articles that I went through this video down below in the description, so you can check it out down there. But let me ask you, what do you think of these theories? These theories are based with evidence. Do you have any other theories that you know about that are also evidence-based? Do you notice a lack of access to care, a lack of staffing? Do you notice patients putting off their symptoms or putting off coming into the hospital because they want to spend time with their family? Or maybe you've even done that. Let me know in the comment section down below. But that is it for today's video, everyone. Thank you for tuning in. I hope you have a wonderful week, and I'll see you in the next video. See ya.